Hi, Ms. Lopez. My name is Benjamin. I'll be your student nurse today, and I'm here to do a full head-to-toe assessment on you. Okay, before we get started, I'm going to wash my hands for 20 seconds and put on clean gloves, and I've done that. Okay. Before we get started, do you know who you are? May I have your name?
My name is Marianne Lopez.
Thank you. And do you know where you are?
Yes, I'm in the doctor's office.
Yes, and do you know why you're here?
Yes, I'm here because you're going to do a study on me, head to toe.
Yep, exactly. And do you know who the president is?
Yes, it's Joe Biden.
Yes, great. So you are alert and oriented ×4. That's very good. Now, do you have any questions before we get started?
No,
And did you have to miss a day of work? How has this impacted your life? Do you need a doctor's note?
No.
No, okay. Excellent. So I'm going to start looking at your head, and I see that it is symmetrical on both sides. It looks like there are no bumps, no lesions on the scalp. I don't feel any lumps. Do you feel any tenderness or pain when I touch this?
no,
No, excellent. I'm looking for any infestations. I don't see any, which is great. No places of baldness. Your hair is thick, it's brown, and it looks healthy. That's great. So I'm gonna look at your face next, the skin on your face. It is pink, it looks dry, it's intact. There are no lesions, no bruises, which is excellent. I'm gonna move down to your eyebrows and eyelashes. They are also there, they're intact, they're symmetrical. I'm gonna look at your sclera, okay, which are white and not injected. That's excellent. Injected means bloodshot. You're holding your gaze, which is excellent. Okay, so next we're going to look at your pupils, okay? So I'm just gonna shine a light in your eye, all right? Before I do that, your pupils are round, equal round, and I'm gonna see that they're reactive to light. They both constricted equally, excellent. And now I'm gonna have you look at this pen light far away, and I'm gonna come into your nose and you just follow it down to your nose. So I'm gonna ask you to follow the light down to your nose, down to your nose. There you go. So you are accommodating, so that's Perla. Very good. You can raise your gaze back to me. Thank you. All right. So next, I'm gonna ask you to smell this. Just gonna put it under your nose, okay? And what do you smell?
it's
Describe it.
you put it in cookies.
There you go. Yes, vanilla.
Vanilla.
Excellent. Okay, so that means that your first cranial nerve is intact. All right. Next, I'm going to ask you to close your left eye, cover your left eye. All right, excellent. You tell me how many fingers I'm holding up.
2.
Great. I'm going to ask you to cover your right eye and ask me how many fingers am I holding up.
2.
Okay, good. So that, yep, that's good. You don't have to do any more. So cranial nerve number 2 is intact. Next, I'm going to check your ocular motor nerve, the third cranial nerve. All right, so we're back to the light. Do you see the light?
Yes.
All right, and you just follow it with your eyes, okay? Okay, so I'm going to amend something, okay? So we're going to do the 6 cardinal gaze, the 6 cardinal places of gaze, and she should be following the light with her eyes, okay? So that's a cranial nerve I know we've discussed before. That's okay, no worries. So next I'm gonna ask you to cross your eyes if you can. Look down, there you go. And now look to both sides. Yep, so 4 and 6 are intact. That's good, you can look at me again. All right, can you hear me what I'm saying?
Mm-hmm.
Excellent. So that's 8. Cranial nerve number 8 is intact. We're gonna go back to cranial nerve number 5. All right. What do you feel? Do you feel anything when I do that?
Yes, you're brushing your hand around my face.
Excellent, yes. And then I'm going to ask you to clench your jaw for me. There it is. So the masseter is intact as well. That's cranial nerve number 5. We did 6, and now I'm going to ask you to smile. This big smile. Okay, now frown. Puff out your cheeks. Good, and stick out your tongue. Great, so that's just for the anterior portion of taste, which we're not going to do, but that's cranial nerve number 7. 8 we did. 9 and 10, I'm going to ask you to open your mouth, okay, and say ah. Yep, your uvula is midline. Thank you. That you don't have to do any more. Thank you so much. And that's 9 and 10. I'm going to ask you to swallow. Good. All right, and now I'm going to ask you to shrug your shoulders a couple of times. Great. That's 11. And now stick out your tongue and wiggle it around. That's cranial nerve number 12. So, with the exception of that third one, we're all intact, but I know you have some vision problems, so that's maybe why you were having some trouble with the cardinal gaze, okay? Hello?
Yes.
Thank you. Okay. All right, so for purposes of COVID, we're not going to inspect the mouth, nose, or ears, but I will verbalize what proper findings should be. So we'll start with the nose. It should be symmetrical and midline to the face. Your nostrils should be patent, meaning you should be able to breathe well through both of them. The turbinates should be pink and not gray and inflamed or irritated, and there should be no discharge. Your ears, I would inspect the ears, make sure there are no lesions, no bumps, no dry skin, no signs of cancer. I would look for wax in the ears, and I would also look for a gray tympanic membrane, and it should be pearly gray. You all right? Okay, good. And then the mouth, I would look for pink, dry, intact. The lips, I would look at the buccal mucosa, make sure it's moist and pink. I'd look under the tongue for any mouth cancer or lesions. On top, I would make sure there's no thrush, no fungal infection, that it's pink, and that the papillae are there. The tonsils, that they are probably a +1, so that the airway remains patent, that the throat is not infected, that the throat is pink, and also I would make sure that her teeth look healthy and that they're all there. There they are. Okay, so next I'm going to listen to your jugular vein. All right, so I'm just gonna auscultate for a bruit. And it's great, I don't hear any swooshing. All right, and finally, I'm going to feel your lymph nodes. Okay, I'm gonna feel the preauricular, postauricular, and I'm gonna go down to the occipital. Okay, I don't feel anything. And then the jugulo-digastric, submandibular, and then the submental. Again, I don't feel anything. And I will use my cheat sheet just for a moment. The superficial cervical, the deep cervical, and then the posterior cervical. Don't feel anything. And then the supraclavicular. Also, I don't feel any lymph nodes. So that's really good. I shouldn't be able to feel your lymph nodes, and I don't. Next, I'm going to inspect your neck. There are no lesions. feels intact. It looks intact and it feels warm, which is good. It's pink. I'm going to test for strength. So go ahead and, there you go. Other side. Bend forward with your neck and now backwards. Do you feel like you have full range of motion?
Yeah.
Okay, good. Next, I'm going to go down to your extremities, your upper extremities. Okay, I'm looking at your arms. They are pink, dry, and it feels like you do not have a fever, which is excellent. I'm going to feel for muscle tone, equal. Go ahead and make a, there you go. You've been working out, haven't you?
Yes.
Awesome. Okay, so then I'm going to feel your artery, feel for the, there it is. It's 2+, and I'm going to feel the radial artery, feeling for equal bilaterally. Done, done, done. Great. 2+, which is a normal finding. That's excellent. You have a normal pattern of hair distribution on both arms. And let's see, there's no cyanosis, no pallor. Cyanosis is blue. I'm gonna just grab your fingertip and the color returns within 3 seconds. It didn't even go away. Let's see the nails, no clubbing, and they look healthy. The nail bed looks healthy as well. Great. All good findings. I'm going to ask you to push down on my hands and then turn them around and push up on my hands. Great, and now push against my hands and don't let me push you over. Excellent, very strong. Now go ahead and do it, like lift some biceps, some weights with your biceps. Good. Now use your shoulder joint. Circle there. Yep. Excellent. Thank you. Awesome.
Sorry.
That's okay. Good. So you have good strength on both arms. That's pleasing. So next I'm going to go ahead and inspect your thorax. All right. That's like your upper chest area. You don't have to take off your shirt for the purposes of this. I'm going to tell you what I'm finding. So I'm going to look at the skin first. No lesions, bumps, or bruises. It doesn't look like. Your skin is pink. I'm going to touch it. It's dry and intact. It's not warm. And it's warm, which it should be, but it's not hot. All right. And next I'm going to do the tactile phragmitis test, which means that I'm going to assess for resonance equally on both sides. Okay, so I'm just going to ask you to say 99 as I move down your chest, okay?
99, 99, 99.
Say it a little louder, 99.
99.
Great. Now I felt resonance on both sides, it's equal. I'm also going to just put my hands here. I'm going to ask you to take a deep breath through your mouth. Go, you can breathe, Go, breathe. Yeah, breathe normally, you're fine.
Oh.
Go ahead, open your mouth. When you breathe in, breathe in. It's not that late, Mom. Okay, so good. So I didn't feel, I felt that was equal bilaterally, and there's no use of accessory muscles, so that's good. And it looks like you're breathing comfortably right now. I'm gonna go ahead and auscultate. I'm gonna auscultate, which means listen to your lungs. Okay. So I'm gonna ask you to stand up. Thank you. All right, and I'm gonna go in a ladder pattern down the lungs, and I'm going to start at the apex. Go ahead, give me a deep breath in and out with, oh. I would go down in a ladder pattern. And you okay?
Yeah.
All right, good. So I heard clear lung sounds. I didn't hear any adventitious sounds. I didn't hear crackles, wheezes, or stridor, which is good. So that's excellent. And now I'm going to percuss in the intercostal spaces. And so I'm going to listen for resonance. It's a little harder with these gloves on, so try it one more time. Okay, and what I should hear is resonance, and I do. So I would follow that down the lung, and now I'm going to inspect the back of your lung fields. Okay, and I'm going to ask you to say 99 again.
90, wait a minute.
You're fine.
99, 99, 99,
Excellent.
99.
Yep, good. All right, and I'm also going to listen on the lungs and not over the scapula. So I'm going to make sure I don't do that, but breathe in and out through your mouth. Okay, so for purposes here, she has her shirt on. It's a little bit harder to hear, but I do not hear, again, any stridor, wheezing, or crackles, which is great. I'm also going to take this opportunity to just tap on your kidneys and tell me if you feel any pain. Ooh, surprise, okay. But no pain?
No.
Okay, excellent. Go ahead and turn around. Thank you. Go ahead and sit down. And we're going to move on to your abdomen. So I'm going to ask you to go ahead and lie back. Great. Thank you. And I'm going to just pull your shirt up so we can just look at your stomach. Okay?
Yeah.
And I'm gonna look at the skin. It is dry, intact. I don't see any lesions. I don't see anything that I should be concerned about. No bumps, no bruises, which is very good. And next I'm going to look at the shape of her stomach, and it looks pretty flat, actually. So I'm gonna begin by auscultating, and I'm gonna start in the right lower quadrant and go clockwise. I'm gonna listen for tympany. I'm gonna listen for bowel sounds. I'm going to listen for a full 5 minutes. I'm gonna listen until I hear bowel sounds, or for a full 5 minutes. And hopefully it won't be that long. So I'm going to go ahead and listen now. There it is. Okay, I did hear a little bit of gurgling, so that's good. I was able to hear that. And next I'm going to listen for the arteries. So I'm going to start with the aorta. the renal arteries. And then the iliac. Okay. And also, those are 2+ and strong. And next I'm going to palpate your stomach, okay? I'm gonna percuss your stomach, excuse me, and what I'll be looking for is tympany again. So, all 4 quadrants. Okay, was there any tenderness there?
Yeah.
Okay, so that should mean it's air-filled. And then I'm gonna lightly palpate each quadrant. Do you feel any pain there?
No.
Okay, and then I'm gonna more deeply palpate. Do you feel any pain?
No.
Great, and I'm gonna try and keep my eyes on the patient while I'm palpating those sections. Okay, next I'm going to ask you to sit up again, please. All right, I'll help you out. There you go. All right, and I'm going to do a hook under her ribs to feel for the liver. Hook method. Okay. And on the other side, I'm gonna feel for the spleen, and I don't feel the spleen, and I shouldn't feel the spleen, so that's good. And I did bypass probably the most important section, which is the heart, one of the most important sections. So we're gonna listen to your heart now. I'm gonna first listen to the second intercostal space on the sternal border, that's the aortic. Then the pulmonic is on the opposite side of the other sternal space. The third point down is the Erb's point. Fourth is the tricuspid valve, and then the fifth is the mitral valve, and that's also the point of maximal impulse. And normally we would have you lay on your left side to bring the heart forward and listen to that pulse even stronger. So right now I'm going to auscultate and listen for your heart sounds, okay? So I'm just gonna move this, and I'm gonna feel for that second intercostal space. Okay, now I'm going to do the same. There's the clavicle, first intercostal space, second intercostal space. So I do hear lub-dub, lub-dub. So then I'm gonna go down to the third intercostal space. Okay, and then the tricuspid valve and the mitral valve. Because her shirt is on, I will just say, I'll verbalize, that's okay, thank you. I'll verbalize that I'm also hearing normal heart sounds. Okay. And lastly, we're gonna go to your lower extremities. Okay, I'm looking at your legs, and I don't see any edema, I don't see any cyanosis, any discoloration, any paleness. I don't see any lesions, bruises. There is, I guess you do have a little bit of, your veins are showing a little bit, but that's normal. Bless you.
Excuse me.
I'm going to feel all the way down your legs. It's warm, dry, and intact. I'm going to ask you I don't need to feel your femoral pulse, but I'm gonna ask to feel your popliteal pulses, which are behind the knees. There they are. And if I couldn't feel them, I would use the Doppler. And then I'm going to go down to the dorsalis pedis, which should be right there. Should be I feel it on one side, I'm missing the other side, but we'll say it's equal bilaterally. And then the posterior tibialis. I'm gonna say that's also a 2+. I know the book says if you can feel one on the foot, it's okay because it means that it's perfusing well. I'm gonna look for capillary refill on the toe. It's within 3 seconds. I'm going to look in between your toes, make sure there are no lesions or cuts or infections there. I don't see anything. I'm going to ask you to point and flex your feet. Excellent. Push your feet against, yep, and now push up against my hands. Excellent. Now I'm gonna ask you to move your lower extremities up and down just below your knee. That's excellent too. Go ahead and push up against my hands. Yep, there you go. And now push forward with, yep, and now push back. Good, you are strong bilaterally and symmetrical. Excellent. So now I'm going to ask you to touch your heel to your opposite shin. Yep, other one. Excellent. And now look at me. Thank you. I'm gonna ask you to touch your nose and touch it forward.
Forward.
Or go ahead, touch your nose and bring it out. Now touch your nose, bring it out. There you go. Excellent.
I finally found it.
You got it. And now I'm going to ask you a couple of things on your extremities. Don't take your extremity away. Thank you. All right. Tell me, do you feel soft or sharp?
Soft.
And now?
Ah,
Oh,
sharp.
all right. How about here?
Soft.
Yep. And what about there?
I couldn't feel what that was. It barely touched me. Oh, that's a poker.
That's a poker, exactly. All right, so next I'm going to ask you to stand up. And if the fabulous photographer would follow us out into the hall.
I'd like to blow my nose.
Okay, we can do that. There we go. We're not quite done yet. We're still filming.
Oh.
The star needed a moment. Okay. So I'm going to make sure that the spinous processes on your back are straight. I don't see any scoliosis, kyphosis, or lordosis, which is great. Go ahead, stand up straight. You just did the knee bend. Excellent. I'm going to ask you to close your eyes and keep balance. Excellent. And now, if you would just walk with one foot in front of the other, you can open your eyes. Go ahead and open your eyes. Excellent. Thank you. You got it. You passed.
Okay, good.
All right. And, oh, hold on. And that concludes the head to toe assessment. Thank you so much.